912, welcome back everyone. There is a new health effect showing up in people who have had COVID-19. Experts say they're seeing a rise in the number of post-COVID patients suffering from blood clots in their lungs. Joining me now to talk more about this is Dr. George Cruikshank, a cardiologist at Integris Heart Hospital. Doctor, good morning to you.
Good morning to you.
So tell us how health experts came to discover this increased risk of blood clots.
Well, so in early March 2020, we started getting reports out of mainly Mount Sinai and Columbia in New York City about mainly clots in arteries. So horrific tales of people's carotid arteries full of clot, aortas full of clot, legs full of clot. And it started to become studied. And then it kind of transitioned to what we're seeing now, which is predominantly clots in the veins. So veins in the leg, veins in the upper extremities, and in a lot of instances, clots that travel to the lungs. And what's known now from some studies out of Korea, Japan, and Western Europe is that the virus itself actually roughs up what is known as the endothelium, which is the lining of all of the organs of the body, particularly the vessels. So it sort of roughs up the vessels and gives clots a nice place to land and form. And what's really interesting is about half of the people that have a clot to the lung that's related to COVID do not have clots in their legs. And for the longest time, everyone has always associated when you find a clot in the lung, you immediately look for where it came from, clots in the leg. So it's been an interesting thing. And I think the incidence is about 15%, give or take a few percentage points.
That is scary stuff. Is there a difference between the people that have this and whether or not they're vaccinated or unvaccinated?
So we're seeing a lot of both. So what's concerning and what's not known is this time lag. So for the longest time, we've been telling people just to stay on an aspirin for 6 months, 12 months, because we just don't know. And now there's actually papers to back that up. But we're seeing it. We're seeing people that had COVID 6, 7 months ago, got vaccinated 6 weeks ago, and then show up with a clot. We see people that have had 2 vaccines and a booster, but not very often. It's still predominantly an unvaccinated phenomenon, but to say that it doesn't happen in people who've been vaccinated would be false.
Are there people who are in higher risk groups, whether it's by sex or race or age?
Well, I think it's the usual things that have been espoused, over the last 2 years. So diabetics, people who are obese, people who have underlying vascular conditions, but we've seen some awfully young people too. So you can't really blame a lot of these preconditions on people who are in their 20s and early 30s, because that's a little bit young.
What are some of the symptoms that people should be on the lookout for here?
So when you have a clot to the lung, it's usually pretty self-explanatory. It's just sudden onset, severe shortness of breath. But I think what people need to be on the lookout for in all of their extremities is just unexplained pain and swelling. So, particularly in the legs, if you notice that your calves are a little tight or one's bigger than the other, then it's probably a good time to try and get scanned, particularly if you're within the first few months of having been infected, because there's the chance that you could be sitting on a clot in your vein that hasn't left yet for your lungs, and that would be a great time to catch it. But once it gets to your lungs, it's usually not very mysterious.
And obviously, talk about the long-term risks of leaving these conditions untreated here or undiagnosed.
Well, yeah, pulmonary embolism, particularly if it gets to both sides of the lungs and sits across the main pulmonary artery, which is known as a saddle pulmonary embolus, that can be fatal. So that's as bad as it can get, right? But when you don't treat these pulmonary embolisms over time, you can develop right-sided heart failure, which is not really fixable with anything other than a heart and double lung transplant if it really gets bad. And that's more or less like trying to win the lottery. So the long-term effects of leaving clots and having high pressures in your lungs is that it puts an undue strain on the right heart. And if the right heart really fails, then you're in big trouble.
Are there any other diseases or viruses out there that cause heart problems and clots like this, or is this specific condition unique to COVID-19?
So the numbers are unique to COVID-19, and the reasons for that are probably the subject of another show, because obviously this is not acting like the usual coronavirus. This isn't the usual coronavirus. So you can get things with influenza. So for instance, there was a study in France that was looking at blood clots in the lungs, but ones that had formed in the actual outside, where the deep into the lungs where the gas exchange is, and that rate's about 4, 5, 6%, and COVID is 14. So we see it with some other things, but doubling, tripling, and in some instances, from some studies, quadrupling is something that's unique to COVID. But we do see a little of this with some other viruses.
So for folks watching this morning, what would your message be to them about ways to try to prevent this from happening?
Well, I think if you've been infected with COVID, I think taking a full strength, not a baby aspirin, a full strength aspirin for the next 6 to 12 months is probably a good idea. There was a recent paper that showed that it reduced the incidence of thrombotic events. So that's not a bad idea if you can tolerate it, because I don't think we know everything we need to know about how this happens in the time frame. I've seen it as far out as 9 months. So I usually have my patients take an aspirin, a full strength aspirin, for a year. And some of that's art and some of it's science, but this is an evolving problem, but it's a bad problem, and we need to figure out a little bit more about it.
All right, Dr. George Crescent with Integris Heart Hospital. We appreciate you bringing this to our attention this morning, and yeah, hopefully we can do some more research on this and just try to figure this out. Thank you so much.
Thank you.